Dr. Gary Bellman, we do a lot of no needle, no scalpel vasectomies. Men need to come in for initial consultation, and I'm going to share with you what I tell people when they come in for the consultation for a vasectomy. I usually make a schematic, penis, scrotum, 2 testicles. I joke with men that many men tell me they don't look anything like this, and I apologize. I'm no artist. The function of the testicles is twofold. The testicles make testosterone and sperm. The testosterone is unaffected by this because it goes into the bloodstream, and we're interested in this little tube called the vas deferens. Vas deferens carries sperm from the testicles to the rest of the body, and if you don't want more children, we snip each tube and cause you to shoot blanks. Simple, that's a vasectomy. First photo I show, and this shows what contributes to the ejaculate. Why am I showing this to people? Because men ask, well, will the fluid look differently after a vasectomy? Reasonable question. And I tell people that the fluid will not look differently because the majority of the fluid has nothing to do with the testicles, has to do with these internal glands, the prostate, seminal vesicles, the sperm that gets you pregnant is microscopic to the naked eye. So this we call a before picture, after picture. After this is snipped, the fluid looks the same to the naked eye, but you're shooting blanks, which is typically the intention. The testicles there afterwards do what they're supposed to. They make testosterone, and even after a vasectomy, every 3 months, the testicles make new sperm. It's not released, it's absorbed back into the body. Testicles don't swell. Those are the first 2 photos that I show. I explain to men that these tubes are quite small. If you magnify it, we remove a piece of each tube, cauterize each end, we put a tie or a clip across each end so they don't reconnect them. Old-fashioned technique, big cut here, big cut here. Fortunately today, we do everything through a tiny little hole. It's called no needle, no scalpel vasectomy. Just as safe, just as secure, but everything's accomplished through a little hole, which allows for a quicker recovery. So a vasectomy in our office takes 10 to 15 minutes. That's all it takes. And what happens when we come in an office vasectomy, men come in and we get them on nitrous gas. Nitrous gas is laughing gas, and we have men breathe this gas before we do anything. And once they have 8, 9 breaths of the nitrous gas in their system, then we put some numbing and we do the vasectomy. And the laughing gas makes a big difference as well as the numbing. We put a little Band-Aid on, and as they're getting dressed to leave, the gases out of their system, so they're able to drive home. We ask people the day of the vasectomy to go home, take the rest of the day off, and ice and rest. We tell people they can go back to office things the very next day. Take it easy for a few days. After 2-3 days, you could do most things. We tell people to wait 5, 6, 7 days for anything too strenuous, like sports or heavy lifting. And pretty much after the week, there's no restrictions, except we ask men to still use protection, because even after the vasectomy, the fertility takes a dive, there still can be some sperm in the system. We're a little obsessive compulsive, understandably, and we want to make sure that we have a semen sample that shows 0 sperm, that you're shooting blanks. We use this convenient little kit called Fellow, which you can submit a sample remotely, usually after about a dozen ejaculations. The lab sends you, the patient, and I an email. The email should say 0 sperm. Once we have that confirmation, then you're good to go. No need to repeat. What happens if you change your mind? What happens in 5 years from now you decide that you want more children or children? Then vasectomy is reversible. It's not guaranteed. It's a little bit more involved to put back together. It's a microsurgical procedure, but it's certainly possible. We tell all men about sperm banking. Sperm banking, where you can freeze your sperm beforehand. We emphasize it a little bit more for men who have not had children. And you can freeze your sperm, keep it in the sperm bank. In the event that you ever decide to use it, you can thaw it out and use it. Vasectomy doesn't affect any of our functioning. Doesn't affect erections, doesn't affect pleasure, doesn't affect fluid, doesn't affect hormones. There are really no side effects. There's no long-term consequences of a vasectomy. So I hope that gives you an idea of what a vasectomy consultation is like.